we start with our health lead and new questions today about how your health could be impacted by the actions of Health and Human Services Secretary RFK Jr. We just learned that in the weeks before Kennedy moved to oust Dr. Susan Menares as head of the Centers for Disease Control and Prevention, or CDC, top HHS officials repeatedly pressed her to commit to signing off on potential new vaccine restrictions. That's according to two people familiar with the matter. Also today, it became more difficult for people in 16 states in these United States to get a COVID vaccination. CVS Pharmacy is not offering COVID vaccines in these states we're showing you in this chart, even if you meet eligibility requirements. In all of those states, except for Massachusetts, Nevada, and New Mexico, you can get the vaccine if you have a doctor's prescription. Why this confusing change? CVS cites the current regulatory environment, saying that the chain follows state-level regulations, and in some states, pharmacists cannot provide vaccines until they are recommended by the CDC's Vaccine Advisory Panel. Well, that panel won't meet to make new recommendations until September 18th, and that meeting will take place without multiple high-level CDC officials who just resigned in protest of RFK Jr.'s actions. One of them, Dr. Dimitri Daskalakis, led the Center for Immunization and Respiratory Diseases, and he told CNN RFK Jr. has never received a briefing on measles or COVID-19 or flu from the experts at the CDC.
No one from my center has ever briefed him on any of those topics. Yeah, he's getting information from somewhere, but that information is not coming from CDC experts who really are the world's experts in this area. He's not taking us up on several offers to brief him.
So RFK Jr., the HHS secretary, who, as you may remember, has 0 medical degrees and 0 science degrees, has also never been briefed on the COVID-19 by the CDC, despite long condemning COVID vaccines with all sorts of false accusations, making a number of false claims about their safety. He's now impacting the availability of you to get COVID vaccines wherever you are across the country. Joining us now, former Health and Human Service Secretary Xavier Becerra under President Biden. He's also a Democratic candidate for governor in California. Mr. Secretary, what do you make of this current disruption to vaccine availability at CVS and Walgreens? How big of an impact will this have on people, especially those most vulnerable to bad cases of COVID-19?
First, Jake, it's hard to understand what's going on, why you would go in reverse when it comes to disease prevention and control, why you would get rid of the health experts who've guided us over the years and certainly through COVID. It makes no sense. You're either firing the health experts or you're hemorrhaging the rest. And that makes it impossible for you to be prepared for any future attack that might come from whatever disease it might be.
After this week's high-level resignations at the CDC, Republican Senator Bill Cassidy of Louisiana, who worked as a physician before he entered politics, he said the September meeting of this CDC Vaccine Advisory Panel should be postponed until these vacancies are filled. And he said if it's not postponed, he called on the panel to reject any recommendations. Do you agree?
This should be driven by the science, not the politics. Politicians do very poorly when it comes to science. And if you don't have the scientists in place to guide the politicians who are heading these departments, how can you come out with something that's going to be good for the health of the American people? And so I think it's time for the Senate to ask the right questions. And I understand that Secretary Kennedy will go before them. It's time for him to lay out the answers to why all this is happening at a time when America cannot be unprepared.
You say you work alongside the CDC leaders who just resigned. Some of them worked on infectious diseases. What kind of practical impact could their departures have on the public health of the American people?
Well, how do you prepare? How do you use the data and know where it's taking you if the experts who are the ones who've always examined it to then give you recommendations are gone? How do you continue the collaboration with the 50 state health authorities who really do healthcare in their states? CDC coordinates that. How do you do the coordination for all those states so that you make sure that in California or Texas or New York or Illinois, what we know in one place, the other places will know, so we can coordinate the best actions that we need to take to protect all Americans. And that's what CDC does. It is the glue that helps every state do this the right way. You can't do it the right way if you're not coordinating. You can't do it the right way if you're not using the data. And you can't do it the right way if you don't have the health experts working for you anymore.
What do you think the good scientists at the CDC should do right now, the ones that are still there? Should they stay and fight? Should they also resign in protest? What's your message to them?
Jake, I think they're doing everything they can. Don't think that some of these folks who just resigned this week haven't been thinking about what they could do. It just got to the point where I think they just said enough is enough. As you just heard in your report, they're not even being consulted by the chief of the department or the Trump administration on what best to do when it comes to these infectious diseases. And so I think many of them are holding on. I appreciate all they've done. I know all of the ones who just resigned. They were so impactful when it came to pulling America out of this COVID crisis. In fact, Dr. Daskalakis, who you just saw, he was the person who helped. He was the guy that helped navigate the mpox, the monkeypox infections that we saw, and we were able to stop it from becoming a pandemic. How do you do this work if the people who saved you before are now gone? It's ridiculous.
One of the arguments RFK Jr. makes, Secretary Kennedy makes, is that so many of the scientists and health officials were wrong during COVID because they closed down schools for too long, they shut down businesses for too long. In retrospect, there are a lot of Americans who hear that and say, that's true. What do you say?
Jake, it's not true. CDC did not close any school. CDC doesn't have the authority. Only school officials have that authority. CDC provided information and guidance. We provided recommendations. We never ordered any school closed. We just provided the information that helps you decide how to do your business at home. Remember, I just told you, 50 states control their healthcare. 50 states control their schools. CDC doesn't control healthcare or schools in any state. We provide the data and the science to back up what you do. And so for the CDC to be blamed for what others did is not just wrong, it's wrong-headed, because CDC provided the right information that helped us survive the pandemic, to pull out of it, not just with our health, but with our economy. And to now say CDC is to blame, the professionals, wow.
Former HHS Secretary Xavier Becerra, thanks so much for your time, sir. Appreciate it.